Hi, I'm Dr. Melissa Clark, and today I wanted to cover the menstrual cycle. So, in case you haven't seen her in a while, I wanted a nice image overview of what our menstrual cycle is intended to look like so that you can better identify if there's abnormalities in yours. Starting with the first phase of our cycle, we have the follicular phase. So these first few days here are marked by us shedding the uterine lining that was built the month prior. So starting with day 1, when that first period or first flow starts, that's day 1, and then we count upwards, as you can see along the bottom here. Again, we're shedding the uterine lining that was initially built. That's the beginning parts of the follicular phase. Right above this, you'll see a few hormones noted here. FSH being the first one I want to touch on. That's follicle stimulating hormone. That's a signal from the brain down to the ovaries that helps, you guessed it, stimulate follicles. So this will help your body choose one lucky ovary, because we generally switch which one we ovulate from, fun fact, and it will pick one egg to finish developing so that you can ovulate it. In response to that signal, your body will also start making some estrogen. So you'll see she's starting to rise up here and peaking right around that middle mark that we'll get to in a moment. That estrogen is really important for a few different reasons. One in particular, you'll see along the bottom here, once we're done shedding that uterine lining, she's starting to thicken again. We can thank our wonderful friend estrogen for that. She's trying to make a nice, wonderful, pillowy layer for implantation to occur, because our body's goal hormonally is to potentially achieve pregnancy every month. Even if that's not our intention, that's her intention, so we'll roll with it. So that estrogen rise is getting that nice thickened layer that you can see lengthening towards the end of the graph here at the bottom. The other two hormones that are in blue and in yellow there at the bottom, blue being progesterone, that's going to stay low into the second part of our cycle, which at the top you can see reads luteal phase. And then the yellow, kind of like the estrogen, is following and rising, spiking right in the middle. So a normal follicular phase, this beginning part, is roughly 2 weeks, 14 days. A typical menstrual cycle as a whole, you'll see depicted here, we have all the way up to 28 days. A normal is considered anywhere from 21 all the way to 35, so extending beyond what's written down here. But if we're textbook perfect, then we're roughly 28 days, which is shown along the bottom. In the middle part of the graph where you'll see a spike with estrogen and luteinizing hormone, that is what we call ovulation. So you can see at the top, the egg got from smaller, got a little bit bigger, and then now she's actually being released. That release of the egg is caused by a rise in estrogen and a rise in LH, or what we call luteinizing hormone. So that's kind of phase 2, if you will, but it's a short-lived phase. Once that's completed, we transition into what's called the luteal phase. Now you'll see along the top, this is probably my favorite part of the graph, that the cells, the red ones that were helping that egg get to the final stages of development, turn into this kind of white scrunchy image. That's actually called the corpus luteum. That's why we call it the luteal phase. Now, the corpus luteum is what actually secretes progesterone. So you'll see here that blue line being progesterone, where she was low throughout the beginning part here, and then she got higher after ovulation occurred, and she's kind of at her peak around day 19, 21, and then she's going away. We can thank the wonderful corpus luteum for that. Now, there's some instances where females actually don't ovulate. And so if we don't release that egg that your body worked hard on getting ready, you don't make that corpus luteum, and we don't really make a lot of progesterone, and we can have more abnormal menstrual cycles. It's one thing I like to note for patients who may be bleeding on some sort of schedule. Let's say they're still having a bleed every 30 days. But they're getting a lot of symptoms like breast tenderness, maybe a lot of discomfort with their menses, really heavy, really crampy. those oftentimes can be signs of what we call a luteal phase defect, or not a lot of progesterone production, or the corpus luteum not being present and therefore not producing progesterone. So just kind of a nice side note of something to keep in mind. Now, at the end of that luteal phase, you'll see at the top, the corpus luteum that was once looking pretty plump near the top there is slowly disintegrating. That disintegration occurs if there is no implantation. So if our body senses that no pregnancy occurred, it doesn't have any reason to keep that corpus luteum around. Progesterone is progestational hormone. So it's going to be really important for the beginning parts of pregnancy and gestation. It actually is the main source of progesterone. So the corpus luteum is the main source of progesterone all the way through that first trimester. So if we don't get pregnant in that luteal phase, there's no meeting of the sperm and the egg, then the corpus luteum will disintegrate, which you can kind of see at the top there, and that progesterone will decline and decrease. That drop in progesterone is actually what then stimulates our next bleed and the starting of our next cycle. So you'll see we counted all the way up to day 28, and that drop in progesterone is then what will allow that next day to be our new day 1, followed by our next bleed. Hopefully going over this was a helpful overview. I always like to refresh back to this and go over this with patients. If you have any questions regarding your menstrual cycle, what might be normal, abnormal, or you liked videos like this, let us know below and we'll be sure to give more detail.